Do your ankles leave deep, painful marks by the end of the day? Do your legs feel heavy, swollen, like they're carrying extra weight after a short walk? That puffiness, those indentations from socks, is not just an annoyance. It's a visible sign of fluid that's not moving the way it should, and left unchecked, it can lead to real circulatory complications. If you want legs that stay comfortable, mobile, and strong well into your 70s, 80s, and beyond, the single most powerful place to start is at the dinner table. Tonight, I'll show you exactly what to eat every day to support fluid balance, strengthen vein walls, and reduce the inflammation that makes veins porous and slow. These are the daily foods you must add to your routine to build powerful legs, and I'll also show a short nightly maintenance routine that compounds those benefits. I'm going to be direct. These are practical, evidence-informed food choices and habits. They won't promise a miracle, and they won't replace medical care where it's needed. But done consistently, they change the biology that causes swelling and weakness. If you want the printable daily food checklist and the step-by-step video for the evening routine, hit subscribe and check the link in the description so you can start tomorrow with a clear plan. Let's begin with the simple physiology so the food choices make sense. Two things are almost always in play when legs swell: fluid balance across cells, and the venous system's ability to move blood and lymph out of the legs. Electrolytes, chiefly sodium, potassium, and magnesium, act as chemical signals that tell cells whether to hold on to water or let it go. When sodium is high relative to potassium, cells tend to retain water. That contributes to puffy, sticky tissues. Potassium helps cells release sodium and water back into the bloodstream where it can be eliminated. Magnesium relaxes the smooth muscle and blood vessel walls, improving tone and allowing better circulation. On the structural side, the tiny capillaries and venous valves depend on strong connective tissue, collagen, and elastin. Oxidative stress and chronic inflammation break down those proteins, making capillaries leaky and veins less efficient. Bioflavonoids, antioxidants, vitamin C, and dietary amino acids help maintain and rebuild that scaffold. So the approach is twofold. Every day, feed the body the electrolytes, antioxidants, and building blocks it needs, and every night, give the vascular system a chance to drain, repair, and reset. Diet is the foundation. Nightly practices accelerate the effect. Now let's go through the must-eat daily foods, one by one, what they do, and exactly how to eat them. Potassium-rich whole foods give cells the signal to release excess fluid. Why it matters? Potassium tells cells to let go of sodium and the water that follows. That simple signal reduces the amount of interstitial fluid that pools in the feet and ankles.
High potassium diets are linked to better fluid balance and lower blood pressure, both helpful for leg comfort. What to eat daily? Aim for one focused serving of a potassium-dense food each day. Excellent choices include a medium banana, one medium baked sweet potato, half an avocado, a cup of cooked spinach, or a cup of cooked white beans. If you prefer fruits, a cup of cantaloupe or 2 kiwi fruits will do it. How to include it? Breakfast: slice half an avocado over whole grain toast and add a sprinkle of lemon and pepper. Lunch: a sweet potato with a serving of greens. Snack: banana with a small handful of nuts. Dinner: a salad with white beans and roasted vegetables. If sodium is high in your diet, prioritize these swaps. Choose potassium-rich vegetables instead of canned salty sides, and use herbs instead of salt. Safety and exceptions: if you have kidney disease, are on potassium-sparing medications, or take certain blood pressure drugs, increasing potassium without guidance can be dangerous. Also be cautious with concentrated potassium sources, like cream of tartar, unless cleared by your clinician. If you fall into those categories, speak with your provider before changing potassium intake. Vegetarian and low-sodium options: white beans, lentils, cooked beet greens, and potatoes are all plant-based, low-cost potassium sources. Rinse canned beans well to reduce sodium, or use dry beans cooked at home. 2. Magnesium-rich foods relax vascular tone and support cellular transport. Why it matters? Magnesium is a cofactor in hundreds of cellular reactions. For the legs, it helps the smooth muscle and vessel walls relax, improves microcirculation, and supports optimal nerve and muscle function for the calf pump, your body's natural venous return system. What to eat daily? Include a magnesium-rich item every day. Good choices are 1 ounce of pumpkin or sunflower seeds, a quarter cup of almonds, 1 cup of cooked Swiss chard or spinach, or a small serving of black beans. How to include it? Sprinkle pumpkin seeds on your morning yogurt or salad. Snack on almonds. Add a handful of spinach to a smoothie. Cook beans into soups and stews. If you tolerate dairy, plain yogurt is also a moderate source. Supplement framework and safety note: some people use magnesium citrate at night as part of a pre-sleep flush. The commonly used range from clinical practice is 300 to 400 milligrams elemental magnesium. That dose can help vascular tone and bowel regularity, but it should only be used after discussing with your clinician, especially if you have tinea impairment or take certain medications. Too much magnesium can cause diarrhea, lightheadedness, and in extreme cases, cardiac effects. Dietary magnesium from foods is safer and recommended as the daily foundation. 3. Antioxidant-rich berries and colorful vegetables protect capillaries and reduce inflammation. Why it matters. Oxidative damage weakens the tiny capillaries and the collagen that holds venous structures in place.
Antioxidants neutralize damaging free radicals, while anti-inflammatory compounds lower the chronic inflammation that leads to leaky vessels. What to eat daily? A generous serving, about 1 cup, of berries or a mix of colorful vegetables every day. Berries are concentrated sources of anthocyanins, potent antioxidants that support capillary health. Vegetables such as red bell peppers, beetroot, botany, and leafy greens bring a range of antioxidants and phytonutrients. How to include it? Add a cup of mixed berries to your breakfast cereal or yogurt. Blend a handful of frozen berries into your smoothie. Fill half your dinner plate with colorful cooked or raw vegetables. Roast beets and toss them into salads to promote circulation with both flavor and nutrition. Practical tips and swaps. If fresh berries are expensive, frozen berries retain antioxidants and are more affordable. For those on low-sugar diets, pick lower sugar berries like raspberries, blackberries, and strawberries. Safety. Berries and vegetables are safe for most people and carry minimal risk. If you're on blood thinners, talk to your clinician about high vitamin K vegetables like kale and spinach. These are nutritious but may interact with anticoagulant dosing. 4. Bioflavonoid-rich foods and natural venotonics strengthen vein walls and improve microcirculation. Why it matters. Bioflavonoids are plant compounds that reduce capillary fragility, support collagen synthesis, and improve venous tone. Some foods contain natural venotonic compounds that act similarly to botanical extracts used in clinics. What to eat daily. Citrus fruits, whole oranges, grapefruit segments, or lemon peel in dressings. Onions, grapes, especially dark varieties, and small amounts of dark chocolate, 70% cacao or higher, provide helpful flavonoids. A daily cup of citrus or a serving of grapes or an ounce of dark chocolate can be integrated as a habit. How to include it. Start the day with orange or grapefruit segments. Add thinly sliced onion to salads and sandwiches. Include a small serving of grapes with cheese as an afternoon snack or a square of dark chocolate after dinner. Safety and interactions. If you're on certain medications, especially statins or some blood pressure drugs, grapefruit can interact with drug metabolism. Always check with your clinician. Dark chocolate has sugar and calories. Keep portions moderate. 5. Collagen support and vitamin C foods provide the building blocks for vessel integrity. Why it matters. Collagen is the primary structural protein of blood vessel walls. Vitamin C is essential for collagen synthesis. Amino acids like proline and glycine, found in gelatin and bone broth, help supply the raw materials.
What to eat daily? One practical combo is a cup of bone broth-based soup or a gelatin-containing food, plus a vitamin C source such as citrus, bell pepper, or kiwi. If you prefer plant-based options, include legumes and nuts for amino acids and combine them with vitamin C-rich fruits or veggies to support collagen formation from plant proteins. How to include it? Make a simple bone broth at home or use a quality low-sodium broth. Sip it as a warm snack or use it as the base for soups. Add salad with bell peppers and citrus to meals. For a quick option, mix a scoop of collagen peptide powder into your morning tea or coffee, accompanied by a piece of fruit. Vegetarian alternatives. Combine beans or lentils, protein, with generous servings of vitamin C-rich vegetables for the same biochemical support. For example, lentil soup with tomatoes and bell peppers is a plant-based way to feed collagen pathways. Safety. Collagen supplements are generally well tolerated, but always choose reputable brands and disclose supplements to your healthcare provider. Vitamin C doses from food are safe. Very high supplemental doses can cause gastrointestinal upset. 6. Omega-3 and anti-inflammatory fats quiet chronic inflammation. Why it matters? Inflammation contributes to capillary damage and venous deterioration. Omega-3 fatty acids reduce systemic inflammation and support endothelial health, aiding circulation. What to eat daily? Aim for a serving of fatty fish 3 to 4 times per week, or include a small daily source of omega-3s, such as a tablespoon of ground flaxseed or a handful of walnuts. If you don't eat fish, consider a doctor-approved fish oil supplement. How to include it? Grilled salmon for dinner twice a week, canned sardines on whole grain crackers, or a tablespoon of flaxseed in your morning oatmeal. Use extra virgin olive oil for dressings. It's anti-inflammatory and heart-healthy. Safety and interactions. High-dose fish oil can thin the blood slightly. If you take anticoagulants, discuss dosages with your clinician. Food-based omega-3s are generally safe. 7. Low-sodium, high-fiber base. Reduce fluid retention and improve venous health long-term. Why it matters? Too much dietary sodium promotes extracellular fluid retention. Fiber supports a healthy weight and metabolic profile, reducing pressure on the venous system. A diet that limits added salt and emphasizes whole grains, legumes, fruits, and vegetables reduces the drivers of chronic swelling. What to eat daily? Aim to cut back on processed salty foods and prioritize whole foods, a serving of whole grains, legumes, and at least 5 servings of fruits and vegetables a day. Simple swaps, no table salt added, rinse canned foods, and choose fresh or frozen over packaged, make a big difference. How to include it? Replace chips with raw vegetables and hummus. Choose whole grain bread and brown rice instead of white. Use herbs and citrus for flavor. Drinking adequate water is still important, but time it thoughtfully. Avoid heavy fluid intake within the 3 hours before bed. This is part of the nightly routine, and I'll explain it shortly. Safety. For people with heart failure or certain kidney conditions, sodium and fluid restrictions may be different. Follow your provider's guidance.
Practical daily serving checklist. This is your must-eat list. 1 potassium-rich serving, banana, sweet potato, avocado, or white beans. 1 magnesium-rich serving, a small handful of nuts or seeds, cooked spinach or beans. 1 cup of berries or a colorful vegetable serving. 1 bioflavonoid-rich item, citrus, grapes, onions, or a square of dark chocolate. A collagen support item or protein plus vitamin C, bone broth or beans paired with citrus or bell pepper. Omega-3 source, fatty fish, flaxseed, or walnuts. High fiber whole food base and low added salt. Keep this checklist handy in your kitchen. Start each day by checking off 1 item from each line. Small daily consistency compounds into measurable changes in weeks to months. Before we move to the nightly maintenance routine, a quick behavioral note that relates directly to diet. Late-night heavy drinking, especially of salty or alcoholic beverages, undermines the potassium to sodium balance and promotes fluid retention and poor sleep quality. Aim to finish your main fluid intake at least 3 hours before bed. Hydration during the day is important. Sip steadily, but avoid big pours late at night. Now, the nighttime routine. Think of this as the amplifier. If diet lays the foundation, the following 7 steps help your body drain and repair overnight when circulation is naturally slower. Do these as a short ritual most nights, especially if you end the day feeling heavy-legged. Night routine step 1. Pre-sleep gentle electrolyte balance. Magnesium plus a small potassium flush. How to? About 30 to 60 minutes before bed, consider a magnesium citrate dose in the range of 300 to 400 milligrams elemental magnesium if you tolerate it and your clinician approves. Some people combine this with a small potassium source. Traditional home measures include a pinch or about 1/4 teaspoon of cream of tartar dissolved in a glass of water as a mild potassium boost. Use this only if your kidney function is normal and you are not on potassium-sparing medications. If you have kidney disease, are pregnant, or take ACE inhibitors, ARBs, potassium-sparing diuretics, or other relevant medications, do not do this without your provider's approval. Why it helps. Magnesium relaxes vascular smooth muscle and can ease the sensations of tightness, while a controlled potassium boost encourages cellular release of excess sodium and water. Together, they can reduce evening puffiness and support a better overnight reset. Safety. These are physiologic nudges, not treatments.
If you experience heart rhythm irregularities, dizziness, or severe diarrhea after supplementation, stop and contact your clinician. Start with the lower end of the magnesium range and see how you tolerate it. Night routine step 2. Contrast foot baths, warm then cool to stimulate circulation. How to? Prepare 2 basins, 1 comfortably warm, not scalding, and 1 cool, perhaps with a bit of ice if you tolerate it. Sit and immerse your feet in the warm basin for 2 to 3 minutes, then move to the cool basin for 20 to 30 seconds. Repeat this cycle 2 to 3 times. If you have neuropathy, vascular disease, or temperature sensitivity, skip the cold or use milder temperature differences. Why it helps. Alternate heat and cool trigger the body's microvascular pumping response. The vessels dilate with warmth and constrict with cool, encouraging movement of pooled fluid and stimulating lymphatic flow. Safety. If you have diabetic neuropathy, impaired sensation, or severe peripheral vascular disease, consult your clinician before using contrast baths. Check your skin frequently for redness, blistering, or unusual pain. Night routine step 3. Active calf pump. Legs up the wall plus ankle flexes. How to? Lie on your back and prop your legs up against a wall with hips close to the wall. Elevate your legs for 5 to 10 minutes. While the legs are vertical, actively flex and point your ankles and squeeze the calves every 10 to 15 seconds, 10 to 20 repetitions, to engage the calf muscle pump. Why it helps. Elevation reduces hydrostatic pressure in the legs, and the active ankle motions drive venous return, 2 quick ways to move fluid out of the ankles and feet. Safety. If you have orthostatic symptoms, lightheaded on standing, or recent cardiac concerns, ease into this and consult your clinician. If you feel dizzy, stop and sit upright slowly. Night routine step 4. Topical Venonic massage, cypress and rosemary blend. How to? Dilute a few drops of cypress and rosemary essential oil in a carrier oil, grapeseed, sweet almond, or olive oil. A typical ratio is 2 to 3 drops essential oil per teaspoon of carrier oil. Perform a gentle upward massage from ankle to knee for 3 to 5 minutes on each leg. Always patch test a small area of skin before first use to check for allergic reactions. Why it helps. The topical massage stimulates lymphatic flow, and the botanical oils have traditional uses supporting venous tone. The mechanical action of massage helps push fluid towards central circulation. Safety. Essential oils can cause skin irritation or allergic reactions. Patch test and stop if redness, itching, or burning occurs. Do not use if you have open wounds or active skin infections. If you're on anticoagulant therapy, discuss topical massage intensity with your clinician to avoid bruising. Night routine step 5. Low-grade nighttime compression. Gently help the veins while you rest.
How to? Wear light travel socks or low-grade compression socks rated 8 to 15 mmHg while sleeping. These are mild and meant to support gentle drainage, not tight clinical compression. If your clinician has prescribed daytime compression, follow that prescription for daytime wear, commonly 20 to 30 mmHg for moderate varicose symptoms, but do not sleep in tight high-grade compression unless specifically instructed. Why it helps? Light compression reduces ankle swelling overnight by supporting venous return without restricting circulation during sleep. Safety. Too tight compression can cause tissue damage. If you see deep indentations longer than 15 to 20 minutes after removing socks, or increased pain, tingling, numbness, or color changes, stop use and consult a clinician. People with certain arterial diseases should not use compression without medical clearance. Night routine step 6, 3-hour fluid fast before bed. How to finish your main drinking for the day at least 3 hours before your planned bedtime. Sip small amounts if needed, but avoid heavy fluid intake right before lying down. Why it helps? It reduces the amount of circulating fluid that can redistribute to the legs while you sleep, and it decreases nocturnal trips to the bathroom that interrupt sleep and recovery. Safety. For those with medical conditions requiring night fluids, like some heart or kidney conditions, follow your clinician's personalized guidance. Night routine step 7, bedtime venotonic supplements as a targeted boost. How to? Many clinicians use standardized botanical venotonics at bedtime. Typical doses used in practice include horse chestnut seed extract (HCSE) at 300 mg standardized to approximately 50 mg acene, and pine bark extract (pipagenol) around 100 mg. Take these only after discussing with your clinician, checking for drug interactions and allergies. Why it helps? These botanical extracts have clinical evidence showing they can reduce capillary leakage and improve venous symptoms in some people. Combined with your daily diet and the nightly drainage steps, they can be part of a comprehensive strategy. Safety and interactions. Always discuss supplements with your clinician, especially if you take blood thinning medications, because venotonics can interact with anticoagulants. Pregnant or breastfeeding individuals should avoid some herbal extracts unless cleared by a healthcare provider. Stop if you develop gastrointestinal upset, allergic symptoms, or unexpected bruising. A few practical adjustments and habit hacks you can implement immediately. Replace evening chips or salted snacks with a potassium-rich option and a low-sodium dip. This shifts your electrolyte balance toward less sodium retention. If you sit for long periods, reading, watching TV, or traveling, stand up and march in place for a few minutes every hour. Light movement activates the calf pump and prevents pooling.
Avoid crossing your legs for long periods, and if you sleep on your side, place a small pillow between your knees to prevent kinking of femoral vessels. For footwear, choose supportive shoes with moderate cushioning. Avoid overly tight shoes that might constrict circulation across the ankle. Red flags and when to seek immediate care. If swelling is sudden, painful, warm to the touch, asymmetric, one leg suddenly much worse than the other, or associated with shortness of breath or chest pain, seek immediate medical attention. These can be signs of deep venous thrombosis or other urgent conditions. For chronic progressive swelling, persistent skin changes, or non-healing ulcers, consult a vascular specialist for evaluation. Putting this into a weekly and monthly rhythm. Daily, follow the must-eat checklist every day. Combine potassium, magnesium, antioxidants, bioflavonoids, collagen support, omega-3s, and a low-sodium, high-fiber base. Nightly, perform the short evening ritual most nights. Pre-sleep magnesium, if approved, contrast foot baths a few nights a week as tolerated, calf pump and elevation nightly if possible, topical gentle massage, low-grade compression, and a 3-hour fluid fast. Weekly, plan 2 to 3 solid days centered on fish or high omega-3 meals. Consider a cooking session to pre-chop veggies and batch a bone broth soup you can use during the week. Monthly, check in with your provider to reassess medications, kidney function, and whether any supplement adjustments are needed. Why this combination works. Food changes the systemic environment, electrolyte balance, antioxidant capacity, and the availability of collagen substrates, so tissues are less likely to leak and retain fluid. Nightly mechanical and topical interventions speed the removal of whatever excess remains and support overnight repair. Together, they address both root causes and daily symptoms. Remember the safety caveats. Do not start electrolyte tricks, high-dose supplements, or herbal venotonics with medical clearance if you have kidney dysfunction, pregnancy, are taking anticoagulants, or are on medications that alter potassium or magnesium handling. If you are unsure of your kidney status, ask your clinician for a basic metabolic panel before trying higher-dose magnesium or potassium interventions.
To help you begin immediately, here is a concise printable-style checklist you can copy into your phone notes or print and place on the refrigerator. Daily food checklist. Start here tomorrow. Potassium, 1 serving. Banana, or 1 medium sweet potato, or 1/2 avocado, or 1 cup cooked spinach, or 1 cup cooked white beans. Magnesium, 1 serving. 1 ounce pumpkin seeds, or 1/4 cup almonds, or 1 cup cooked Swiss chard. Antioxidants, 1 cup berries, or a colorful vegetable serving. Bioflavonoids, citrus, or onions, or grapes, or 1 ounce dark chocolate, 70+. Collagen support, bone broth or protein plus vitamin C, beans plus bell pepper. Omega-3s, fatty fish 3 times a week or daily flaxseed walnut serving. Low sodium, avoid added salt, swap processed snacks for whole fruits. Nightly mini routine, optional but powerful. 3 hours before bed, limit fluids. 30 to 60 minutes before bed, magnesium citrate 300 to 400 milligrams if approved. Small potassium boost only if cleared by clinician. Contrast foot baths 2 to 3 cycles, if safe. Legs up the wall plus ankle flexes for 5 to 10 minutes. Gentle upward massage with diluted cypress or rosemary. Patch test first. Wear 8 to 15 millimeters light night socks if comfortable and approved. Consider HCSE 300 milligrams standardized to around 50 milligrams Essen plus pycnogenol 100 milligrams if approved by your clinician. Start small. Pick 2 foods from the checklist to add tomorrow. Maybe a banana at breakfast and a cup of berries with lunch. Add 1 nightly step this week. Legs up the wall for 5 minutes after your evening routine. Build until these habits are routine. Over weeks to months, you'll notice less visible swelling, easier movement, and greater comfort doing the things you love. If you want the downloadable checklist and the step-by-step nighttime demonstration, hit subscribe and grab the link in the description now. I've put together a printable you can tape to your fridge and a companion video that walks through each night's step, including demonstrations for safe massage and contrast baths. You don't have to accept heavy, swollen legs as inevitable. By prioritizing the right foods every day, potassium, magnesium, antioxidants, bioflavonoids, collagen-supportive protein omega-3s, and a low-sodium base, and pairing them with a gentle, regular night routine, you give your circulatory system the tools to do its job. Start today with 1 food swap and 1 5-minute night habit. Small daily choices build powerful legs over time. Download the checklist, begin tomorrow, and when you're ready, watch the next quick video. The 3 foods that quietly damage your vascular elasticity so you can stop them before they undermine your progress.